So in this video we'll talk about chronic myeloid leukemia, but before that we need to discuss some of the important things. First of all, what is leukemia? Leukemia is the malignant proliferation of the white blood cells. Now, leukemia is classified based on whether it is myeloid in lineage or whether it is lymphoid in lineage. Plus, it is also classified based on whether it is very acute or whether it is chronic. So it is classified based on myeloid lineage versus lymphoid lineage. Plus, it is also classified based on whether they are acute or whether it is chronic. In acute form, we know that the symptoms will be very rapid in onset, and there will be presence of blast cells in bone marrow, whereas in chronic form it is very slow in onset. The symptoms appear very slowly, and it is slow in onset, and there is malignant proliferation of the mature cells. It is very important to know that it is not blast. These are the mature cells formed. So as we know, in bone marrow we have hematopoietic stem cell that differentiate into myeloid stem cell or lymphoid stem cell. The lymphoid will then go on to produce B lymphocyte and T lymphocyte, whereas the myeloid stem cell will produce first of all myeloblast. And if there is malignant proliferation of that myeloblast, we say that it is acute myeloid or acute myelogenous leukemia. But if there is neoplastic proliferation of the more mature forms of the myeloid lineage, for example, the red blood cells increases or the granulocyte or the platelet increases, we call it myeloproliferative disorder. Myeloproliferative disorder. So what is myeloproliferative disorder? It is the neoplastic proliferation of the mature cells of the myeloid lineage, right? We then further classify this myeloproliferative disorder based on which of the following myeloid cells increase or proliferate greater. For example, if red blood cells proliferate malignantly, increase in number, we say that it's polycythemia vera. If platelets increases in number, we say it's essential thrombocytosis. And if this granulocyte increases in number, we say it is chronic myeloid leukemia. Now, what are granulocytes? Granulocytes are, of course, as you know, neutrophils, basophils, and eosinophils. So in CML we will have leukocytosis, that is our white blood cell count will increase number from greater than 100,000 microliter. Normally it is between 5 to 10,000, right? Now in peripheral blood we will have increased number of neutrophils, increased number of basophils, and increased number of eosinophils. Now the CML basically progresses through different phases. In the first phase, we call it as chronic phase. The second phase is accelerated phase. And the third phase is blast crisis. Now what happens in chronic phase? In chronic phase, usually the patient is asymptomatic. Of course, we know there is leukocytosis on when the patient do a blood test, CBC. Normally the patient normally have a fatigue, malaise, weight loss, and some of them can have splenomegaly. Now in accelerated phase the symptom get worse, like the patient have splenomegaly, bone pain, bleeding, infection, and this phase usually transforms into blast crisis. This blast crisis phase is the most common cause of death in patients, and this phase then usually converts or transforms into AML, acute myeloid leukemia, because the mutation is in the pluripotent stem cell. So this phase usually 70 to 80% it basically transforms into acute myeloid leukemia, and the patient dies because of this phase. This phase, chronic phase, is usually asymptomatic, and patient have simply malaise, fatigue, weight loss. Whereas in accelerated phase, the symptoms get worse, and then this accelerated phase converts into blast crisis, which then converts into acute myeloid leukemia. So in CML, we have increase in the number of white blood cells, whereas in leukemoid reaction, there is also increase in white blood cells. So how will we differentiate between CML and leukemoid reaction? So there are three important points which you need to remember. Number one is LAP. LAP is actually leukocyte alkaline phosphatase enzyme that is present in the neutrophils. This enzyme is present in the neutrophil. Normally in CML this enzyme would be negative, because in CML there is like rapid proliferation of these white blood cells, so this enzyme will not be present in the neutrophils of the CML, whereas in leukemoid reaction this LAP enzyme is there, leukocyte alkaline phosphatase enzyme is there in leukemoid reaction. The second thing is, in CML we will have increase in the number of basophils. That is extremely important point. There will be increase in the number of basophils, whereas in leukemoid reaction there is only increase in the neutrophil count. The third and most important point is, in CML we have a translocation between chromosome number 9 and chromosome number 22, that the new translocated chromosome is called Philadelphia chromosome, and this chromosome basically produces tyrosine kinase. So this tyrosine kinase will cause the malignant cells to have a longer life, because this tyrosine kinase allows the white blood cells to escape apoptosis. So these white blood cells have a longer life. So the treatment is usually to give a tyrosine kinase inhibitor, that is imatinib. This is a tyrosine kinase inhibitor. Number one is imatinib, the second one is dasatinib, and the third one is nilotinib. So these are basically our tyrosine kinase inhibitors. This is what we give to the patients who have this translocation. So that is all for today. See you in the next video. If you like my video, please subscribe my channel.